people at Virginia Mason Sport Medicine took great care of me.
Hi, I'm Julie. I'm obviously not a professional athlete, but I love to play sports. I tore both my ACLs, and the folks at Virginia Mason Sports Medicine gave me great care too.
So our goals for our patients who've injured their anterior cruciate ligament are to return them to the level of function and activity level that they had prior to their injury with a pain-free and fully functional knee. You know, whether you're a professional athlete, an elite high school or college level athlete, or whether you're a soccer mom or a recreational tennis player, you still have the exact same process here at Virginia Mason in your evaluation, your surgery, your recovery, and your rehabilitation. Well, the initial assessment is done, and then based on your activity level, what your expectations are, what you'd like to do, a decision will be made about whether you are best served with surgery for your anterior cruciate ligament or not. Some individuals who are not as active may be able to progress and to live their life without having their anterior cruciate ligament. Most of the patients that we see here, however, are active and want to return to sports activities, either elite sports or recreational sports, and they are most likely best served with an anterior cruciate ligament reconstruction. Initially, most people are swollen and stiff after their injury, so we institute a program of rehabilitation to regain the motion in your knee. That's critical. Decrease the swelling, get your function back before we consider an operative intervention. The surgery would then take place. It would be a same-day surgery. You are able to go home that day. We see you back here in our clinic in 2 to 3 days. And start a rehabilitation program. No brace at that point in time. We progress immediately to full range of motion. One can ride an exercise bike very quickly after the surgery. Most people are walking around pretty well within a month or so after the surgery. We allow biking and swimming at about 6 weeks. A running program can be undertaken once you have achieved a certain level of strength. That's typically 8 to 12 weeks. At about 4 months out, we do some testing looking for biomechanical deficits, so specific areas of weakness or lack of control in the knee. One of the biggest issues that we worry about after ACL reconstruction is rupturing that reconstruction. You tore your own ligament, you can certainly tear the one that we put in your knee. And the risk of that is significantly less if you have good control and balance in your knee. So the question always arises, hey doc, when do I get to go back and play? And the answer to that is it's at least 6 months, but it's also based on whether you passed your functional testing that we do. Here at Virginia Mason, we've been doing anterior cruciate ligament reconstruction surgery for over 30 years. We have participated in all the advances that have occurred during that point in time. Virginia Mason Medical Center is known for its high-quality, patient-centered care. And here at the Sports Medicine Clinic, we strive to be part of that. You will have your own individual surgeon who will know you and be responsive to you, will listen to you and your concerns and help you make a decision with your input about what you want to have done for your injury. You will have a specific contact person, that physician's assistant, either the nurse or medical assistant, who will also be familiar with you and know you. And you will have a physical therapist here at Virginia Mason Medical Center who will be a contact person if you have any questions about your rehabilitation. Whether that physical therapist is your routine physical therapist. For some of you who may get physical therapy outside the system, you will still have that physical therapist who will meet with you at every physician visit and will communicate with your rehabilitation specialist outside the system.
Thanks to the sports medicine team at Virginia Mason, I'm back playing all the sports that I love.
Thanks to the Virginia Mason Sport Medicine team, I'm back on the field with my teammates.